Hi everybody, my name is Mitchell Farmer and this is Laboratory 1 of the Head and Neck series covering the orbit today. So I wanted to start us off with some osteology, first talking about the orbit margins and then the orbit walls. So the orbit margins are kind of the outer osseous rim around the orbit. And so the orbit margins are going to be superiorly the frontal bone, highlighted here. And the frontal bone has a process to it known as the zygomatic process right here. And that's going to form part of the lateral margin of the orbit. And it's going to articulate with the frontal process of the zygomatic bone. So you have the zygomatic process of the frontal bone, and then the frontal process of the zygomatic bone. I can show you that here if you're confused. This is the frontal process of the zygomatic bone. So you have the frontal superiorly, the zygomatic and frontal process, and the zygomatic bone laterally. Inferiorly, you have a section of the zygomatic bone here, and you also have the maxilla. And then medially, we have, similar to this side, we have the frontal part of the maxilla bone, and then the maxillary part, or the nasal part of the frontal bone. Right here, frontal bone, maxillary bone. So those are the margins, kind of just that outer osseous rim. If we look at the actual walls or boundaries, we have the frontal bone forming the roof. The lateral aspect, or the lateral portion of the orbit, is formed by the zygomatic bone anteriorly in the greater wing of the sphenoid bone posteriorly. And if I take us into that multicolor mode, the zygomatic bone, as you can see, is quite complicated. But these lime green sections, those are the greater wings, and that's going to form part of our lateral boundary or lateral wall. The floor is formed by the maxilla with small contributions by the zygomatic and palatine bones. This floor separates the orbit from the maxillary sinus. So if I take us into multicolor mode here, basically if I look up, this is the floor. Through the floor there's something known as the infraorbital canal and foramen, which transmit the infraorbital nerves and vessels. And if I show us a medial view, we can see the maxillary sinus highlighted here. And so the only thing between the maxillary sinus and the orbit is the bone of the maxilla. X out it there. And then finally the medial wall, which is the most complicated. Anteriorly, we're going to go anterior to posterior. Anteriorly, there's the frontal process of the maxillary bone, right here. And then posterior to that is the lacrimal bone. Posterior to that is the orbital plate of the ethmoid bone. And then finally, the posterior wall and the posterior aspect of the medial wall is all of the sphenoid bone, which I showed you previously. Now, there are a couple important openings that lead into the orbit area. I'm going to start with the what's known as the superior orbital fissure. And the reason I'm going to start with that, so highlighted here, the superior orbital fissure, is that's going to be probably the most important opening for our sakes as we go through the rest of this lab. It transmits a whole bunch of stuff. It transmits the ocular motor nerve, cranial nerve 3, the trochlear nerve, cranial nerve 4, the abducent nerve, cranial nerve 6. And I'm going to cover all these throughout the rest of the lab, but it also transmits branches of the ophthalmic division of the trigeminal nerve. So that's the supraorbital fissure. And finally, it transmits the superior ophthalmic vein. So that's the superior orbital fissure. If we go medial to that, we come across the optic foramen, which is continuous with the optic canal. It transmits the optic nerve and ophthalmic artery. And if we go inferior and kind of look at a medial view here, we can see this space right here. That is the inferior orbital fissure, which leads to the pterygopalatine and infratemporal fossas. So if I follow this space here and I wrap around so that we have a lateral view, this, I'm going to hide this as well and hide them. And this is the space that we're looking at here. And that is continuous with the orbit via the inferior orbital fissure right here. And the inferior orbital fissure transmits the maxillary nerve, particularly the zygomatic branch of the maxillary nerve. And the maxillary nerve basically has its own entire lab, so you'll hear more about it then. The final thing that I want to discuss is the lacrimal fossa, or the fossa for the lacrimal sac. that is this hole right here, formed by the maxilla and lacrimal bones, and that houses the lacrimal sac, which aids in draining the tears from the eye into the nose, which is part of the reason you get a stuffy nose when you're crying. Okay, so I'm going to pull up another view here. And we can talk a bit more about the superior orbit. So this looks pretty terrifying, lots of stuff going on, but I'm going to go through it systematically here, starting on your right or the model's left. So first we're going to discuss stuff that exits via the superior orbital fissure that I spoke about earlier. So the first thing I want to discuss is the ocular motor nerve, cranial nerve number 3. So this innervates every extrinsic eye muscle with the exception of the superior oblique and the lateral rectus. I'll go over those eye muscles again later, but basically this innervates all the extrinsic muscles of the eye with the exception of those two. I'm going to hide that. If we look superior and medially, we come across the trochlear nerve. So the trochlear nerve is in the area that the superior oblique muscle would be in, which I will show you later. It's cranial nerve number 4. I'm going to hide that now, and then finally go on to the abducent nerve. This is the last of the 3 nerves that innervate the extrinsic muscles of the eye, also known as the extraocular muscles. And it's going to innervate lateral rectus, so it makes sense that it's coming out of this foramen and then moving laterally. So I'm going to hide that. And then we have the ophthalmic branch of the trigeminal nerve, which is cranial nerve number 5. And I'm going to go to the right side of the model, or your left, to review that a bit more. So this is what I'm talking about, this highlighted blue guy here. And it gives off 2 branches known as the frontal branch and the ciliary branch. And it actually gives off a 3rd branch, but it's unfortunately not present in this model. So those are the 3 nerves. I'm going to get rid of this guy over here. Now we can talk a bit about some vessels that exit through that way. Sorry about that. Zooming in on me here. Okay. So the most important vessel for our purposes is going to be something known as the superior ophthalmic vein. So the superior ophthalmic vein is formed by the union of the supratrochlear and the supraorbital veins. So they basically just drain the forehead area. So the supraorbital and supratrochlear drain the forehead to form the superior ophthalmic vein. And the reason the superior ophthalmic vein is important is that it anastomoses with the facial vein via the angular vein. So superior ophthalmic, angular vein, down to the facial vein. That's its distal anastomoses. Its proximal anastomoses is something known as the cavernous sinus. So I've highlighted it, and if I rotate posteriorly, we can see it right here. So the cavernous sinus anastomoses with the superior ophthalmic vein. And the reason that this is important is it provides a route for, say, infection from the facial vein all the way through via the angular vein, via the superior ophthalmic vein, all the way through the cavernous sinus. And a number of critical structures travel through the area of the cavernous sinus, and it makes them vulnerable to that infection or to whatever it might be. And this is known as cavernous sinus thrombosis. The structures that travel through the cavernous sinus include cranial nerve 3, 4, 6, in addition to the ophthalmic and maxillary divisions of the trigeminal nerve and the internal carotid. So a lot of important stuff. And so it's important clinically to realize that there's a connection between all of those veins and this cavernous sinus here. Now, there's one muscle I wanted to talk about while I have us in this view, and it is the levator palpebrae superioris, because I don't have it present in the view that I'll be showing you shortly here. So it's not a muscle of the eye in the sense that it doesn't cause a direction of movement of the eye. What it does do, though, is it elevates the upper eyelid, and the superior rectus lies just deep to it. So I'm going to hide those two guys. And then we can get to talking a bit more about the optic canal, highlighted here. So the optic canal transmits the optic nerve. So the optic nerve is a special sensory nerve responsible for vision. And as I'll show you later, within the optic nerve is the central retinal artery. So I'm going to hide the optic nerve so that we can look at the ophthalmic artery. So the ophthalmic artery lies just deep or superior to the optic nerve, as you can see before I hit it, and it crosses the optic nerve laterally, so it crosses superior and laterally as it emerges out of the optic canal into the orbit. And then it moves to the medial aspect of the orbit to give off the supratrochlear and dorsal nasal arteries. I guess it's the first branch of the internal, or the first intracranial branch of the internal carotid, prior to the internal carotid contributing to the circle of Willis for blood supply to the brain. So that's about as much as what I wanted to say for the optic foramen. I'm going to pull up the muscles of the eye so that we can review them here. So, starting with the muscles that are innervated by the ocular motor nerve, cranial nerve number 3, we have the superior rectus, which attaches to the superior aspect of the sclera. Then we have the inferior rectus, attaches to the inferior portion of the sclera. The medial rectus, and then the inferior oblique, which lies superficial to the inferior rectus. So those 4 muscles are innervated by the ocular motor nerve. The other 2 muscles, the superior oblique is innervated by the trochlear nerve, and then the lateral rectus is innervated by the abducens nerve. The 4 rectus muscles, they all have a common proximal attachment. So if I zoom in here, you can see it right here, the common tendinous ring or annulus of Zinn. So that's the common proximal attachment of those, and it encircles the optic canal in the supraorbital fissure. This ring does. Alright? Now I just want to make a comment about kind of the weird shape of the superior oblique muscle. So I'm going to put in the frontal bone, and it'll probably make a bit more sense. So the superior oblique muscle forms a kind of pulley system with the frontal bone. So if I highlight the frontal bone, you can see this little dab here of blue that kind of wraps around the superior oblique muscle, allowing it to form that pulley system so it can move the eye in the plane in which it moves it. So that's kind of a very interesting really interesting anatomical fact. And just to reiterate, this is innervated by the trochlear nerve, cranial nerve number 4. Now last, for wrap up, I'm going to very quickly discuss a little bit about the trigeminal nerve, as well as the internal carotid and the central retinal artery. So a quick overview of the trigeminal nerve. So basically we have the trigeminal nerve here. This is a posterior superior view of the head, and I've removed the top of the skull. I guess I could just show you that context. And then posterior. Here we go. And zooming in here. So here's the trigeminal nerve, and it goes to the trigeminal ganglion. And then it has 3 branches, V1, V2, and V3. V1 is the ophthalmic branch, and as we already know, it enters the orbit through the superior orbital fissure to give off the nasociliary, lacrimal, and frontal nerves. Then V2 is the maxillary branch, which exits the head via the foramen rotundum. And then finally, V3 is the mandibular branch, which exits through the foramen ovale. So that's just a really quick overview of the trigeminal nerve. Hopefully we'll be able to get around to discussing more of it later. The other thing I want to discuss is kind of a way that you might have some help finding the abducent nerve when you're looking for it in the cadaveric dissection. So you can find the internal carotid, a big artery highlighted here, and the abducent nerve is going to lay just lateral to it in the cavernous sinus here. So just lateral to the internal carotid if you're having trouble finding it. And it is quite hard to find the nerves in the cadaveric dissection for this lab. And now finally, the very last thing I want to discuss is the retinal artery. So the retinal artery branches off the ophthalmic artery and enters the confines of the optic nerve to supply blood to the retina. So I've hid the optic nerve, but if I show it, you can see that the retinal artery is actually right in the center of it and travels through it to get to the retina to provide blood supply to it. Alright, so that's everything for Lab 1. I will see you for Head and Neck Lab 2.